Thank you very much. Really appreciate the nice folks from BioStime to invite me to give a talk in the middle of the night. We'll see how this goes. But what I was asked to do was to talk about the microbiome and its potential for manipulation in disease states going forward. And this is kind of almost a philosophical talk. You're not going to learn about any products. You're not going to learn about any new therapies today. But I hope that at least what you will do is think about things in a different way than you did before after you see what I'm going to present to you. These are my disclosures. There are several things that I do for anybody who asks, and if you need anything done, ask. The next slide, to get right into the meat of the material, since we don't have much time, is to talk about observations that you may have made in your clinical practice. I've been practicing pediatric gastroenterology for, I think, about 45 years, and one thing I've noticed is I see a whole lot more inflammatory bowel disease than I used to. And I see an awful lot more allergic kids than I used to. And I think you've all, who've been doing this for a while, have probably observed the same thing. Allergic proctocolitis. We've seen this in babies for many, many years. Now, we're starting to see it in older children. I saw one last week, children coming in with colitis who turned out to have an underlying cause of food allergy. It's been reported to occur in adults now, which we didn't used to see. And of course, there's this disease. I'm sure you're seeing a lot of these now. I think I see a new one of these at least once a week. 20 years ago, we never saw them, eosinophilic esophagitis. So these are all things that are changing in our environment and that have changed dramatically in recent years. And there seems to be a correlation between the increase in the incidence of a lot of these immune disorders and the changes in diversity of our microbial populations in the gut. One thing that we've learned in populations, including our own populations on this planet, is there's value in diversity, and that's also true in the colon. And if you don't have adequate bacterial diversity, it seems like bad things tend to happen. So what we're seeing now is more and more of these kinds of disorders and immunologically related disorders, and they seem to be associated with our modern lifestyles. And is it possible that these could be related to changes in our microbiome, since they seem to be associated with changes in microbial diversity? Of course, these are just observations. Do they mean anything? Are there any data that really back this up? And I think we're starting to see enough data to suggest that, in fact, our microbiome may be at fault for some of this stuff. And there may be some opportunities going forward to manipulate the microbiome to change this. And that's kind of the theme that we're talking about today. We can do bad things. We've known for years that giving kids antibiotics early in life is probably not a good thing. If you treat babies 2 or 3 times with antibiotics during the first year of life, you're going to perturb their microbiome. You'll also increase their risk of developing allergies down the road. What I think may be even more interesting is PPIs. I think most of us in pediatric gastroenterology have learned not to dump PPIs into babies all the time if they get fussy. First of all, it doesn't make them any less fussy, and secondly, it disturbs the microbiome, and they have an increased risk of developing allergic diseases later on in life. Yet people still do it. So here's an opportunity. C-sections. You can avoid doing C-sections. Risk of allergy goes down. So where are we likely to see the opportunities here? Where can we really make a difference? Well, we mentioned allergic diseases, possibly inflammatory bowel disease, obesity, neurobehavioral disorders. I think these are some of the big ones. They're certainly not all of them, but I want to show you a little bit of data that might suggest that there are opportunities here. Now, all of you know that there are a couple of ways that traditionally we try to manipulate the microbiome. Probiotics and prebiotics, of course, are the ones that come to mind. Probiotics are bacteria, prebiotics, bacterial food. I mean, that's a pretty simple explanation. So let's talk just for a moment about prebiotics. And the only thing I'm going to say about these is to put up this picture. I always liken prebiotics to a bird feeder. You put a bird feeder in your yard and it attracts birds. And hopefully you can put little seeds in there that attract the birds that you like to look at, but then you find out that, gee, it's not all that specific because a lot of other things will come in and eat the what's in the bird feeder too, which is the problem with prebiotics. We look at it, we say we want a prebiotic that increases bifidobacteria, but it increases a bunch of other things too. So they're not really very specific. However, what may be somewhat specific and probably what we need to be thinking about a little bit more is